In Thailand, the Thai people have benefited from the Universal Health Coverage Scheme for over a decade, since 2002. The UHC scheme has caused many changes in the Thai public health system so that all Thais can have access to standard health services according to the changing economic, social, and political context. In this regard, health personnel and agencies concerned, directly and indirectly, have to adapt themselves to efficiently implement the established guidelines. True success is not in the learning, but in its application to the benefit of mankind. Increasing access to essential renal dialysis through PD First policy. Ban Phaeo Hospital. End-stage renal disease, ESRD, is a health problem among Thai adults and regarded as a high-cost illness. Under the Universal Coverage Scheme, UCS, peritoneal dialysis, PD, is the treatment that can be accessed by the Thai people. But before making such eligibility available, a pilot study was undertaken to seek suitable practical guidelines. Dr. Prateep Thanakicharan, Acting Secretary General, National Health Security Office, NHSO, said, "We have chosen this method of treatment because of people's better benefits and coverage. This is in line with the preparation of the health service system of the country in terms of workforce, as well as knowledge and understanding among service providers and recipients. We carried out a pilot project and experimented with service procedures at healthcare facilities to gain confidence before announcing that the patients are eligible for such a service." Here is Ban Phaeo Hospital, public organization in Samut Sakhon Province. It is one of the 3 hospitals in Thailand that participated in the pilot study, aimed at seeking a suitable service model of peritoneal dialysis for patients with end-stage renal disease under the Universal Coverage Scheme. The study was done before officially announcing that the service is available under the UCS. Dr. Surapong Bunprasert, advisor to the director, Ban Phaeo Hospital, said, "At that time, we had been providing hemodialysis through blood vessel that began over 10 years earlier. When we began to experiment with peritoneal dialysis, we had to prepare our workforce, including doctors and nurses, to understand it. Some staff were sent for additional training. After that, they started rendering PD service despite having some problems initially, such as infections and misunderstanding, as they had not seen any example before. Later on, everything is settled." Dr. Piyatida Jungsaman, nephrologist, Ban Phaeo Hospital, said, "Upon accepting the PD First policy, the first thing we thought of was the large number of patients accessing the service and surviving from chronic kidney disease. Later on, we were worried about the knowledge of peritoneal dialysis that was little initially. So, we were determined to develop the skills and knowledge for all relevant personnel and collect service data to confirm that the quality of this method is not different from that of hemodialysis. That is the answer to the question from other medical personnel and the general public." Today is another day on which Uncle T, or Mr. Ekalak, comes to the hospital for his monthly follow-up care. As a patient who has suffered from end-stage renal disease for several years, every time he comes here, he joins group activities to exchange knowledge and experiences in healthcare, get physical examination with the doctor, and receives medications as well as necessary supplies before going home with his daughter. Uncle Thi is a representative of the majority of Thai people who are low and middle income earners. When they get sick and diagnosed with high-cost illness, it is rather difficult for them to seek medical treatment at hospital, as that would be a financial burden for their farming families. In the past, Uncle Thi was a photographer who worked hard and did not realize the importance of illnesses. Finally, end-stage renal disease is what he has to encounter. Uncle Thi said, "Previously, with some income, I choose to undergo hemodialysis and had to bear the cost of transportation and treatment. After being unable to work and my savings were diminishing, I began to feel bad about having my wife and daughter bear such expenses. So I decided to change to peritoneal dialysis. So far, the procedure is not as scary as originally thought, and I feel happier. I think it is good if we can strictly follow the doctor's instructions. Having my daughter change the PD solution. Sometime I do it myself, and there is no need to often go to hospital." Mr. Somsak Samut Pongpan is another person who has chosen to take peritoneal dialysis with the care of Ban Phaeo Hospital. He is an employee working in an agricultural garden and can work regularly. Every day he receives peritoneal dialysis in his farm office. Luckily, his employer understands his condition and has specially arranged a place for the procedure. Mr. Somsak said, "I chose this method because I can still work and the expense is not much. Initially, I was not sure about that, but after the doctor and nurse had explained it to me, I understood it. Luckily, it is not as scary as previously thought. Now I am healthy and can work every day." Dr. Rungrawi Mahanopkun, nephrologist and member of the Chronic Ambulatory Peritoneal Dialysis (CAPD) Care Team, Ban Phaeo Hospital, Samut Sakhon Province, said, "We focus on giving the information about both dialysis methods, including advantages and limitations, so the patient can choose the method that suits his or her health coverage eligibility, medical spending ability, and convenience. So to make the treatment more effective, we need to educate the patients before offering dialysis. Community participation has to be sought so that the community will serve as a link between patients and the hospital. Peritoneal dialysis can be performed at home, but medical treatment has to be provided at the hospital. The community can help provide moral support and some inputs for the medical treatment, such as funding and public utilities." At present, medical and health services at hospitals have advanced steadily in terms of knowledge and practices for service recipients, and service providers have also been supported to gain more knowledge and understanding about the services, and to provide follow-up care for patients in the community. From healthcare facility to community, Dr. Prateep said, "As a hospital that participated in the pilot study, Ban Phaeo Hospital had searched for ways to really practice in the hospital and the community with regard to safety, doctor-nurses operations, as well as service units and patients' opinions. The financial and service systems had to be settled, taking in account local residents' ideas." In Thailand, sub-district or Tambon health promoting hospitals and sub-district administrative organizations are also parts of the medical care system for patients with end-stage renal disease. They help make the services under the Universal Coverage Scheme more effective with good quality. Their personnel include registered or professional nurses, public health officers, village health volunteers, and local administrative officer. They all are a driving force that enhances the system's efficiency. Today, they get together in making home visits to patients' places. This elder patient has been taken good care of by the home visitors, who give verbal encouragement, review the information on healthcare, and talk with the patient's relatives about self-care. The collaborative effort is a result of the information sharing and discussion among the staff of the hospital, the sub-district health promoting hospital, and the local administrative agency on joint health services. Another mechanism for healthcare is the funding support from the local administrative organization through the Local Health Fund, which also receives funding from the Universal Coverage Scheme. The local administrative body has set up a local health project to work on the activities related to disease surveillance, health promotion, disease prevention, and curative care. Today, a meeting is held for the Sub-District Health Fund Committee to consider providing support for the patients with end-stage renal disease who live in the community. The meeting is attended by all relevant sectors in the locality who take part in reviewing and setting up policies and practice guidelines at the local level. That is another dimension that links all various sectors in jointly taking care of the community health system. And this is one of the case studies in Thailand on the cooperation and development of the medical care program for patients with end-stage renal disease, which covers more than 150 healthcare facilities throughout the country. With this effort, almost 50,000 patients have avoided bankruptcy from healthcare spending.